On today's episode of Dr. Ozello's Sports Medicine Report, I'm going to be speaking about the lateral ankle sprain. The lateral ankle sprain is one of the most common sports injuries. It is not only a common injury that occurs, but it has a high recurrence rate. And also, if it is not healed properly, it possesses a long-term sequelae where it can cause other conditions. So this is something that is very important. This condition, athletes need to know everything they can to help to prevent this condition and what they can do to help to treat this condition, to rehab properly and completely if this condition does occur. Now, an ankle sprain is very common. There can be three types of ankle sprains. There can be the lateral ankle sprain, the high ankle sprain, or the medial ankle sprain. A lateral ankle sprain occurs on the outside of the ankle. The high ankle sprain occurs in the ligaments that attach the two big bones in the lower leg together, the tibia and the fibula. And the medial ankle sprain occurs in the inside of the ankle joint. The lateral ankle sprain is by far the most common. 80% of ankle sprains are lateral ankle sprains. An injury to a ligament is called a sprain. There are three general classifications to a sprain. There is grade 1, which is mild, grade 2 is moderate, and grade 3 is severe. In a grade 1 ligament sprain, the ligaments are stretched and there is microscopic tearing. In a grade 2 or moderate sprain, the ligament is partially torn. In a grade 3 or severe sprain, there is a complete rupture of the ligament. Now you may be asking yourself, what exactly is a ligament? Well, ligaments are connective tissue. They attach one bone to another bone. They're made of tough collagen fibers, and they help to stabilize and support joints by preventing excessive motion. Again, they help to stabilize and support a joint by preventing excessive motion. So if we think of the lateral ankle ligaments, they help to prevent excessive motion of an ankle motion called inversion. Inversion is when the ankle turns inward so the bottom part of the foot faces the center of the body. Obviously, that's a normal motion of the ankle, but excessive inversion will cause injury to the lateral ankle ligaments. I am going to explain the anatomy of the lateral lower leg to help you understand what exactly a lateral ankle sprain is. Lateral means that it is further from the center of the body. We have the medial side and the lateral side. So this is the medial ankle, this is the lateral ankle. The bone that runs on the lateral lower leg is called the fibula. It is a long and slender bone. This big bump right here is the lower aspect of the fibula. This is called the lateral malleolus. There are three ligaments that attach the lateral malleolus to the foot. Two of them attach to the talus bone. One of them attaches to the calcaneus bone. The calcaneus is the medical name for the heel bone. So we have the tibia, the fibula, the lateral malleolus is part of the fibula. It's this big bump down here. And then the talus and the calcaneus. There are three ligaments: the anterior talofibular ligament, the calcaneal fibular ligament, and the posterior talofibular ligament. Those are the three ligaments in the lateral aspect of the ankle. Two of those are injured more than the other one. The anterior talofibular ligament and the calcaneal fibular ligament are injured much more often than the posterior talofibular ligament. Now these ligaments, what they do is they help to prevent inversion. Inversion is this motion right here. So if there's an excessive amount of inversion, the lateral ankle ligaments are going to become injured. That is the process of a traumatic lateral ankle sprain, is excessive inversion. A lateral ankle sprain can have a traumatic or a non-traumatic onset. I had already spoken a little bit about the traumatic onset, which occurs when there is an excessive amount of ankle inversion. This is one of the most common sports injuries that there is. This can happen in all sports. It's most common in jumping or running sports. An athlete may land on another athlete's foot, and there may be an excessive amount of inversion. Talk about sports like volleyball, basketball, football, any type of jumping. They may also just land incorrectly with the ankle in too much of an inversion and cause this injury. It can also be caused while running or cutting. This is a common cause of traumatic ankle sprain. Also, the non-traumatic lateral ankle sprain. This is an overuse injury. All overuse injuries occur from too much training and inadequate rest combined with a biomechanical fault. A biomechanical fault with a lateral ankle sprain may be weakness in those ligaments, may be weakness or instability in the ankle joint itself or in the surrounding muscles. Recurrence of a lateral ankle sprain is extremely common. In most cases, the recurrence occurs because the original injury was not healed completely. Those ligaments may still lack the strength to support the joint the way that it should. So that is why a reoccurrence occurs. Those ligaments are not as strong as they should. There may be poor proprioception, and any type of stress that's added to that area contributes to a reoccurrence of the lateral ankle sprain. The symptoms of a lateral ankle sprain, when it's a traumatic onset, will be felt immediately. Instant, sharp, intense pain will be felt by the athlete. They may fall to the ground, or they may lift up the legs so that they won't have to bear weight on that injured ankle. There's going to be limited strength and limited motion in the ankle. There's going to be swelling and bruising. The swelling may persist for months. It is going to be located right over the ligaments that are injured and around the lateral malleolus. The bruising may be so intense that it's in the lateral aspect of the foot and all the way up to the knee in the lateral ankle. I have seen cases like that. Believe me, you feel sorry for the athlete that has suffered that injury. A non-traumatic ankle sprain, the lateral ankle sprain, and non-traumatic onset, the symptoms are going to have an insidious onset. So they're going to begin slow, but they're going to be a deep, dull, achy pain with tenderness to the touch, a limited pain-free range of motion, limited strength. There's going to be limited ability to bear weight. So pain will occur with standing, walking, running. Anything where weight is being placed on that joint is going to be painful when there is a lateral ankle sprain. There may be some bruising, but there's also going to be swelling. And that swelling, again, may persist just like it did when there was a traumatic onset of the ankle sprain. Other symptoms of a lateral ankle sprain include instability in the joint, weakness in the joint, weakness in the lower leg, and a feeling of giving way, a feeling of instability. That's why it's extremely important to do everything you can to prevent this injury. And if you get this injury, you want your rehabilitation to be as comprehensive as possible. Many athletes have suffered a reoccurrence of a lateral ankle sprain. If symptoms should occur, take action immediately. A severe ankle sprain may be worse than a fractured bone. And the reason I say that is because in most cases, a fractured bone is going to heal so that it's stronger than it was before the injury occurred. But a ligament, because ligaments do not get as much blood supply as other structures, they do not heal as fast as other structures do. And sometimes they don't heal as well as other structures do. So your rehabilitation needs to be as comprehensive as possible. And it may take a long time, and you're going to have to be patient, but your patience will pay off. Prevention, prevention, prevention. I know I've said this in almost all my videos, but prevention is key in sports medicine. Prevention is easier, faster, and less expensive than injury rehabilitation. When we're speaking about prevention of an ankle injury, we want to strengthen the ankles, we want to improve the proprioception of the ankles. Proprioception is the body's awareness of where it's at in nature. A great way to strengthen the ligaments of the ankle and to strengthen the entire lower extremity and to improve proprioception is to use an unstable surface for your training. You can use something like a rocker board, a wobble board, or a Bosu ball. These are great tools to help to improve the strength and stability of your ankle. So use these tools. It will help you to prevent this injury. If symptoms should occur, if you suffer this injury, can be a traumatic onset or the non-traumatic, take action immediately. Do not hesitate. Get professional care. You'll probably need x-rays just to make sure that there's not a fracture. Safe thing to do. When the injury occurs, you want to use ice. You can place an ice pack on the injured ankle, or if you have a bucket where you can put ice water into, you can do that and place the entire foot and ankle into the ice bucket. While you have your foot in the ice bucket, if you have the strength, if you have the ability to do it, move your ankle through a pain-free range of motion. Do not push into pain or do not push through the pain. Just move through a pain-free range of motion. That range of motion may be 5 degrees, but it's still important to keep it moving. And you're going to have to do this for a while. If it's a severe sprain, you're going to have to stay off it for a while. You're going to have to let it heal. But what you want to do is work it through non-weight bearing exercises. Once you, like I said, you use the ice in the beginning, but once you're finished with that, you can move the ankle through different ranges of motion. I always tell people, write the alphabet. Write it, first of all, print it, all the capital letters, and then print all the lowercase letters. And then the same thing with cursive. So you're moving your ankle through a variety of motions. Again, you want to make sure that you're moving through a pain-free range of motion. You don't want to overdo it. You don't want to push through an injury. You want to bring blood flow to the muscles and to the ligaments, but you don't want to overdo it. You don't want to keep moving it through a you don't want to move it past that pain-free range of motion. And the pain-free range of motion may be very small in the beginning, but it's going to slowly increase. Your rehabilitation should include, first of all, your non-weight bearing exercises, like I already mentioned, and then you want to slowly progress to weight-bearing exercises. You want to do motion exercises, strengthening exercises, stability exercises, proprioception exercises. Your rehabilitation may be long and tedious, like I mentioned before, but it's going to pay off if you are patient and you work this extremely hard and you're consistent through your care. It's going to take some time, and you want this to heal completely. You want your rehabilitation to be comprehensive. I know I've said this over and over again, but the main reason I say this is because you do not want to suffer a recurrence. A recurrence, that's going to set you back. It's going to be extremely frustrating. So do everything that you can to rehabilitate this completely the first time so that you have strength in the joint, you have stability in the joint. Mentally, you are prepared so that you're not worried about your ankle being injured again. Once you return to activity, first of all, your return to activity should be extremely gradual, extremely gradual. Once you return to activity, you want to be 100% confident that you can do this activity without re-injuring the ankle. So you want to make sure that you've done everything that you possibly can. Again, motion exercises, strengthening exercises, stability exercises, proprioception exercises are all going to help to improve the health of your lower leg and your ankle and help you to rehabilitate the lateral ankle sprain. Pay close attention to how your ankle feels before, during, and after your rehabilitation. Pay close attention to how it's responding to everything that you're doing. Have what I call your workout journal or your treatment journal, whatever you want to call it. So you write down everything that you do to see, first of all, to see your progress, but then also to be able to see what's working and what's not working, see what is being effective, seeing what is being most effective. A training journal is a great tool to help you to not only progress through this injury, to recover from this injury, but to help you with your training all the time. So it's something I recommend to everyone. Also, thinking about your diet, when you talk about nutrition, you want to eat anti-inflammatory foods. Make the healthiest food choice that you can. Thank you so much for viewing today's episode of Dr. Ozello's Sports Medicine Report. I greatly appreciate it. Please feel free to leave questions, comments, or feedback in the comments section below. Also, please feel free to like this video. If you want to, go to my website, championshipchiropractic.com. You can learn more about the book. Helps if I hold it the right way. You can learn more about my book, and you can also connect with me on other social media sites. Please do your best to prevent ankle injuries. Ankle injuries are extremely common. The lateral ankle sprain is one of the most common sports injuries that there is. Do your best to prevent this injury. If you get this injury, your rehabilitation should be comprehensive. Do strengthening exercises, motion exercises, stabilization exercises, and proprioception exercises to recover from this injury and to prevent a recurrence of the lateral ankle sprain. Lateral ankle sprain is a chapter in the book. It is chapter 17, page 98. You will get additional information on the lateral ankle sprain than what I went over today. Please feel free, like I said before, to leave any questions, comments, or suggestions in the comments section below. Thank you so much for viewing today's episode of Dr. Ozello's Sports Medicine Report. Always remember, train hard, train smart, stay injury-free, and accomplish your goals.